Welcome everybody, and thank you very much for coming. As you know, what I wanted to do this evening was introduce you to integrative assessment technique, which is the work that I do, and show you the value of it and show you the relationship of how we look at structure, emotions, and biochemistry, and how that all relates in using a muscle testing technology and applying all the principles of physiology, nutritional biochemistry, and how to put that all together, and why that is a model that can really bring nuances to what we can't do without it. You will gain further and further insight into your process, bringing forward and gaining better clinical outcomes. What I've done is I've taken the model of using a very advanced muscle testing technology, and I've cross-referenced it against using blood chemistries and using functional medicine, because at the end of the day, if I stood up here or take my patient and I test him and I'm doing muscle testing, and you look at me and I go, you got this, and this is on, how do you know you're right? You have to be willing to cross-reference yourself and see whether or not you're right. I was getting better than a 90% correlation coefficient between what I said was so on my muscle testing, and I was coming back on the lab work. First, tell me why. Give me the reasons, give me that rationale. Let me get to these roots, these cores, and help people on a much deeper level. First of all, you can pull so much data if you do the testing right in the way that I show you. You can't, it'll literally blow your mind how accurate it is that you can pull the data off of a patient doing the exam in the way that I'll show you. Secondly is you can cross-reference it if you do it right to prove that your process is right, so you know that for yourself. All of this is great, and I use it too. So when I say this, I'm talking about synergistically and where to put it all. And you run these panels and you go, see, there it is, boom. He's got a parasite over here, and he's got this, and he's got his elastase 1 enzyme is off, and this guy doesn't have good pancreatic function, so we got to supplement with that. Boom. And you're like, okay. Now what if I told you that you could find a lot of it doing this? In the model, in the IAT model, we start off with there are 3 base representational points for systems in the body. One is the structure, neurological system. One is the mental, emotional, perfect example. And one is the biochemistry. So when we start out, just take a anterior deltoid, because that's the only muscle I'm going to use for the whole testing. And then there's all of these different reflexes on the body represent different organs, glands, systems, conditions, and so forth. And you're navigating through them to find out which ones are active or inactive. I broke them down into sequences. So you got structure, emotions, biochemistry. See, and it just falls out. Well, why? Why is it if I push here, I push here, I push here? Why should there be a change in this tonicity of the muscle, of it contracting like that? Is because these reflex points that represent those systems, conditions, glands, and so forth, when they're functioning normally, they're giving off, they're expressing an energy field around themselves. And when there's a disruption, not knowing what the disruption is, but when there is a disruption within that organ, gland, system, tissue, what have you, it has created an incongruity in the electrical field around it. This is a circuit. So think of us electrically. I'm touching her like an electrical conductivity, because it is. Here's my open probe. Healthy heart, I touch it, it's strong, complete circuit. Dysfunction in the heart, whatever it may be, I touch it, there's a break in the electrical field, it blows. See, the reason I call it integrative assessment technique is not because it's Lauren's assessment technique. It's integrative. You integrate processes. You integrate other systems. You learn what I teach you. You know everything you already know, and you apply what you know already to what I'm adding to what you know. It's not the other way around. You can draw from it pieces, or you can embrace the whole process. That's up to you.